Do you use any post-liposuction device protocols,
We do
swelling,
talk about this.
massage, lymphatic drainage? Let's start, Jason.
Yeah, Jason and
Young
I
Jason.
both talked.
Yeah, we kind of talked about this already,
Old Jason.
RF.
Yeah, I do.
Talk
RF.
about it?
My panel.
How
here is
quickly
talking
do you
about it.
start?
Yeah, I mean, the question is, when do you start it? If you start it too early, it hurts. So they won't do that. So you got to wait till it calms down a little bit.
But you were talking about other countries, and Alfredo Hoyos and some other people
Yeah.
do massaging and RF and all these things pretty much right away. But it's it's to the patients, because if they're too much pain or too swollen, you can't. But once you can, I mean, you should start it, I think, as early as when I first started, I wasn't. And now that I'm doing that, I see much less risk, much less irregularities and improved results.
One of the things I didn't mention before is we actually use some of the unfocused ultrasound devices for post-liposuction. It kind of helps mobilize some things, and I'm not sure if it's going to be better than the RF or not. Like specifically the Vaser-shaped device.
Yeah.
We have. I don't know if I go spend the money for that. I'd probably say if you're going to spend the money, buy an RF device first. If you have a lot of stuff, then get that.
I agree. One of the things I do is kind of giving away my tricks, but I do give diuretics and a little bit of Adderall post-treatment because there's studies. Yeah, there are studies that show in the lymphedema literature that a little bit of amphetamine causes a decrease in swelling. And ever since I started doing high-def liposuction, I mean, the results are actually pretty dramatic. I now obviously have to limit it because the patients who come in and end up seeing this great change in their body, they think that it's the medicine more than the surgery and their diet and their exercise, and start to want to do it. So I only give it for 6 weeks post-treatment. But there is lymphedema literature on using 5 to 10 milligrams a day to
Have you tried, what about like, Adderall is a really controlled substance that you're going to probably get dinged for prescribing, but you're probably better off with like phentermine.
Yeah,
or
you
something
could
like
do
that.
any there's no studies on that, but in any sort of stimulant, how it does is it works to change the dilatory action on the vessels, so that's why you get more lymph flow. That's why I think the RF and suction devices help with mobilizing and moving in the tissue, so you get a decrease in swelling.
Any comments from the audience? Some of you have a lot of experience. Any addition to this?
Interesting.
No? Okay.
Has anybody had experience with the radiomagnetic aspect of the Venus device for this?
For swelling, you're saying?
That one.
Yeah.
I mean, I've noticed a significant amount results with that, with under eye bags and swelling in that area, and I've seen people who've come in who had sort of swelling from fillers, and you reverse it a little bit, but they still have that swelling there. And I think that it's not necessarily the filler, it's a lymphatic issue from either needle or the filler that's causing something changes with water. And if you use the pulsed electromagnetic fields there, you get improvement. So I think that if it's working there, it probably is working post-liposuction.